Good evening, everyone, and a very warm welcome for today's session on understanding the silent threat liver cancer awareness, organized by Voice of Healthcare in collaboration with ESAI Pharmaceuticals India. My name is Simran Chaudhary from Team Voice of Healthcare, and I welcome you all for today's session. As we are just talking about the liver cancer, and it is often called silent threat because it can be developed without obvious symptoms, and yet it has a profound impact on our health. So, understanding the early signs, diagnostic tools, and advanced care is crucial, not just for patients but for everyone who wants to maintain a healthy liver. Our liver performs critical role from detoxifying harmful substances to aiding digestion, storing energies, supporting immunity. Yet those subtle changes in liver function can go unnoticed, which is why awareness and timely medical interventions are so important, and we do not take our liver for granted. So today we are privileged to have with us Dr. Swapnil Dhampalwar, consultant in clinical and transplant hepatology at Medanta, the Medicity Gurugram. Dr. Swapnil brings extensive experience in liver disease, cancer management, and transplantation. And today he will guide us through the earliest symptoms of liver cancer, advanced diagnostic tools, treatment options, and supportive care strategies. Welcome to our show, sir. We are really happy to have you with us.
Thank you, Simran, and thank you, VOH and Isai for this opportunity. I think it's very apt moment, and we celebrate October month as a cancer awareness month, and it's very important for the people in this part of the world to know that it's very important to know the health of your liver and to screen them at the right point of time. If you have something called as liver disease or liver cirrhosis or advanced fibrosis, it's very important to to get yourself screened for liver cancer so that we can pick them early and we can have treatments with curative intent. So I think we will be discussing the same over the next 20 to 25 minutes with Simran.
Very rightly said, sir. We are going to discuss everything which is possible and to get all the insights and expertise from you, sir, to educate and aware our public out there. So, starting with this, we always emphasize on the early diagnosis for any disease. Now, focusing on liver cancer because we know if diagnosed early, we can treat it then and there, and a person can have a healthy, happy life again. So, what are the earliest signs and symptoms of liver cancer that often go unnoticed by patient, and why is early detection so crucial, sir?
Yeah, so coming to your question, so early diagnosis is very important in any cancer because if you can detect them early, you can institute treatments with curative intent. If you detect them in the latest or advanced stage, then curative treatment is not possible, and you end up treating them with palliative intent so that to sort of prolong survival, improve quality of life, and other stuff. So that's why early detection is the key to have prolonged survival. And in patient, in terms of liver cancer or hepatocellular carcinoma or HCC, what we say. So we need to know that HCC for development of liver cancer, liver cirrhosis is the most common predominant risk factor. So a cirrhotic liver is a fertile soil for malignancy, and it develops because of multiple reasons, of which like alcohol, fatty liver disease, or what we call like them as MASL, and viral hepatitis like hepatitis B and C are most common risk factors. So it's very important to for us to know the risk factors because the risk factors give you the opportunities for prevention, right? So if you know the risk factor, if you're aware about the risk factor, you can screen yourself at the right point of time, pick disease, if any, at the early stage, and then institute a right timely treatment. So if you have any of such risk factors, like alcohol, significant alcohol intake, obesity, diabetes mellitus, fatty liver disease, chronic hepatitis like hepatitis B and C, then you are at risk of development of liver disease, what we call it as liver cirrhosis, which may lead to liver cancers as well. And in few patients, liver cancer may develop in the absence of liver cirrhosis, that what we are seeing in patients with fatty liver disease. So these patients who have these risk factors should screen themselves for liver health, whether they have liver disease or not. And if they have liver disease, then obviously a liver specialist or a hepatologist will do a diagnostic evaluation, a holistic evaluation accordingly, if the surveillance for liver cancers is needed. So by doing them screening at the right point of time, we can pick cancers which are sort of small at early stage and give treatment with curative intent, which are available as applicable.
Thank you so much for that response, sir. And I think it is very valuable for our audience out there to understand why it is important for the importance of early detection. So, and now shifting our focus to patients with chronic liver conditions or any other risk factors, how do you recommend that they monitor themselves for potential liver cancer?
So patients who have liver diseases or chronic liver disease or cirrhosis, we monitor them by their biochemistry, their imaging, and their symptoms. So coming to the symptoms first, because this is what the patient may or may not come with. So patients who have early disease, they might not have significant symptoms. They have subtle symptoms, maybe just loss of appetite, unintentional weight loss, some mild pain in the abdomen, these are sort of can be ignored, and that's why if uh, they are ignored and they are not evaluated then and there, that may lead to disease progression. And whenever they have advanced disease, then they have significant symptoms like symptoms related to liver disease. They may have jaundice, they may have some swelling over the feet, abdominal distension, lump in the abdomen. So these kinds of symptoms present at the late stage. So early stage have subtle symptoms which should not be ignored, and adequate health checkups should be done. Apart from symptoms, we see biochemistry and imaging in such patients. So patients of liver disease or liver cirrhosis, we monitor them by usually by ultrasounds every 6 monthly. And patients with liver disease or liver cirrhosis, it's important to get an annual dynamic imaging, what we call them as a CT scan or an MR scan, along with an alpha fetoprotein, which has to be done 6 monthly. So surveillance strategies are basically ultrasound plus AFP every 6 monthly, and a dynamic imaging, that is a CT or MR, at the baseline whenever the patient has been diagnosed with liver cirrhosis, and subsequently every year, to know what they have, like do they have liver cancers. So liver cancers accordingly have been sort of graded on the imaging based on LR, the LIRADS classification. LR5 lesions are called as cancerous, LR1 lesions are benign. So depending upon what kind of findings are there at the baseline, we can decide the subsequent optimal screening strategies for such patients.
Thank you for that, sir. So, could you explain us the current advanced diagnostic tools and treatment options available for liver cancer? Why? Because in the last 2 to 3 decades, we have seen a tremendous amount of technological advancements, research, trials, and it has been done a lot in space of healthcare. So I'm pretty sure that in terms of in space of liver cancer, there must be other advancements of diagnostic tools available right now.
Yeah, so your question has two parts. One is the diagnostic tools, and second is the therapeutic options. So the diagnostic tools, as I said, we need biomarkers. So we have biomarkers to sort of predict or to see the likelihood of underlying liver cancer. Of one of the most important and widely available is alpha fetoprotein, AFP. So it is recommended to get AFP done every 6 monthly in patients with liver cirrhosis or patients with viral hepatitis and advanced fibrosis. Along with that, we have other markers like lectin associated AFP or AFP-L3 and PUCA2, which are not widely available and are relatively sort of costlier. These are the serological correlates of HCC. Along with that, what we need is a dynamic, a good quality cross-sectional imaging of the abdomen or liver, which are usually a CT and MR. There is something called as an abbreviated MRI, which is done solely for the purpose of screening patients with liver cirrhosis for liver cancer. So these are the two tools, the serological tools and the imaging tools, which we routinely use in clinical practice. These are able to clinch the diagnosis of liver cancers. However, sometimes these tools cannot sort of are not able to confirm a diagnosis of liver cancer in patients who have some liver space occupying lesions. And in those conditions, you can take help of other diagnostic modalities like a contrast enhanced ultrasound or a liver biopsy or a liquid biopsy, where you can see sort of mutated the tumor antigens in the blood.
Thank you
So
so
this
much,
is
sir.
regarding the diagnostic part. I think should we discuss the
Yes,
treatment, right? Yeah.
yes.
So, as we have discussed previously, if we are able to pick up a disease at the early stage, we are able to institute treatments with curative intent. So, if the disease is in the sort of BCLC A or BCLC B stage, we can institute treatments for liver cancer with curative intent. If the disease is very, very small, the patient doesn't have liver cirrhosis, we can take out the lesion, we can do the resection. If the patient has cirrhosis, we can go for ablations. Regions, tumors which are less than 3 centimeter can be ablated with curative intent. And if the tumors are larger than that, then we can consider liver transplantation. So we have three options with curative intent, that is ablation, surgical resection, and a liver transplantation. If the disease is advanced beyond curative treatments, then we have other multiple treatments like intra-arterial therapies, where we infuse chemotherapeutic agents or radiation particles through the blood vessels which are supplying the liver tumors, what we call them as transarterial chemoembolization or transarterial radioembolization. Along with that, we can have external radiation. These are the types of loco-regional treatments which are directed at the tumor. So these are sort of a one-time aggressive or tumor debulking treatments. So if these are possible, then these treatments are given. If the disease are very much advanced and these one-time tumor debulking treatments cannot be administered, then we administer treatments with palliative intent, like a systemic therapy. Then you give the patients are either on tablets or injections. So before 2 decades, before 2007 or 2005, the treatment of HCC was sort of a graveyard. We didn't had any molecule approved for treatment of liver cancer. But since almost last 2 decades, we have a whole plethora of molecules in the conventional therapy or the chemotherapy, what we call it as. We have molecules like from sorafenib to lenvatinib, which have shown increased overall survival beyond 1 to 1.5 years. And along with that, we have something called as an immunotherapy nowadays in our armamentarium. So the principle of immunotherapy versus a chemotherapy, in a chemotherapy, the therapeutic molecule targets the tumor cells, versus in immunotherapy, the molecule targets your own immune cells and then the immune cells mount response against the tumor cells. So this is something called as immunotherapy. And with the advent of immunotherapy, since over last 10 to 15 years, there are paradigm shifts in management of any cancer for that matter. And we have immunotherapy in patients with HCC or liver cancer since almost last 5 years, which have in due to which we are able to now sort of see these patients for beyond a couple of years. So we have data that we can maybe, if sort of treated at the right point of time with the right combination, we can expect such patients to survive beyond 2 to 3 years as well.
Thank you, sir, for explaining us that and how the advancements and the research has helped us in terms of treatment and in terms of diagnosis as well. So now shifting our gears to the lifestyle changes, the lifestyle habits we have. Uh, and if I have to ask that, nowadays people are, they're actually not following a healthy lifestyle. They have their own bad habits. And I think because of that, only these diseases are coming so often nowadays. So, how significant is lifestyle, including diet, alcohol consumption, and weight management, in both preventing liver cancer and supporting patients during treatment? Is contributing to it.
Yeah, so as we discussed previously that alcohol and lifestyle changes, which is predominantly a sedentary kind of a lifestyle, leads to fatty liver or metabolic dysfunction associated steatotic liver disease, what we call them as MASLD now. And it's a very important factor for development of liver diseases and liver cancer. So it is very important to have a healthy life if and avoiding the use of these agents like alcohol is a bad for liver, and having a good diet, diligent control of your blood sugars, maintaining your blood pressures is very important in patients who have fatty liver disease so that we can stop their progression. So just no having fatty liver disease is not important. If they have advanced fibrosis or cirrhosis, they may progress over a period of time. And in that condition, targeting these risk factors are very important because these are, again, as I discussed, these are the opportunities for prevention or for sort of slowing down the progression of liver disease and decreasing the risk of liver cancer in these patients. However, once liver cancer develops in them, then definitely what they need is a tumor-directed therapy, which sort of is more important with along with this lifestyle modification because again they help in further slowing down the progression of liver disease, not necessarily the progression of liver cancer.
Thank you, sir. Thank you for explaining us that. Now, moving ahead, that beyond the medical interventions, what supportive care strategies such as nutrition, exercise, or mental health support can improve the recovery of quality of life for liver cancer patients, and how often do you recommend to your patients?
Yeah, so I think as we discussed, it's very important. So patient's survival or the lifespan will be decided by how bad is the tumor at presentation. And it is the tumor-directed therapy, whatever we will be able to offer them, that decides the lifespan. But all said and done, patients with liver cancer have two diseases in one go. One is the liver tumor or the HCC, along with liver cirrhosis. So it is very important to act on both of these parts. Along with tumor-directed therapy, we need to do holistic evaluation of underlying cirrhosis and manage complications of cirrhosis. Uh, Direct the etiology, if it is alcohol, fatty liver disease, viral hepatitis. So treatment to be instituted accordingly. Alcohol has to be stopped. Lifestyle modifications should be kicked in patients with fatty liver disease. Antivirals should be given in patients who have viral hepatitis. And along with that, we need to screen them for complications of portal hypertension, like which are large varices, ascites, and hepatic encephalopathy. And these treatments, these aspects should be managed accordingly. So this definitely has a sort of definitive a negative impact or a significant impact on patients' overall well-being, quality of life, or mental health. And these factors also needs to be pursued by the treating physician. And these factors also are important in improving the overall quality of life of patient. So if they have any sort of stressor or mental issues, then if they are present, then we sort of try to take it there from there and sort of intervene if at all needed. But it's very important for the patients to know what they are dealing with, what kind of disease is that, what is the prognosis, so that they have a better insight of the disease and they can better sort of cope up with the treatment. That's because there are multiple kinds of treatment. Patient has to come to the hospital day in, day out, multiple hospitalizations, multiple treatments. So it's very important for the patient to have a good insight to cope up with the evaluation and treatment strategies. And definitely there are multiple support groups for that available in any good quality hospital.
I believe so, sir. And I think in the complete journey, this helps a lot in recovery.
Sure, totally agree.
So, as we are moving ahead, so once a patient completes liver cancer treatment, what follow up care is essential and how does it help prevent complication or the reoccurrence of liver cancer?
So as we discussed that cirrhosis is a fertile soil for malignancy, and it's the most common risk factor for development of liver cancers in patients with cirrhosis or liver diseases. So if you have given treatment with curative intent, that is either a transplant, resection, or ablation, that depends. So if the patient has undergone a transplant, we obviously screen them for recurrence in the post-transplant period every 6 monthly, and patients who undergo a resection or ablations, they are again screened every 3 monthly with a good quality imaging, that is a dynamic imaging, either a CT or MRI. Versus patients who are treated with palliative intent, so be it transarterial therapy or chemotherapy or immunotherapy, they are usually subjected for repeated screenings with CT or MRI, along with biomarkers which are available like AFP or DCP or PUCA2 every 3 to 6 monthly. So it is again important to, because these tumors which are treated with palliative intent and even the tumors which are treated with curative intent can come back. So it is important to pick up the recurrence early so that again you can, institute treatments with sort of high impact at a low stage of the tumor.
Thank you for that response, sir. So now, after our question answer round, we are moving ahead to a myth versus fact segment. Every disease has lots of myths associated to it, and I think it's experts' duty to bust them all, and only experts have that right, sir. So, moving with our first notion, that is liver cancer only shows symptoms when it is too late. Is this true?
Yeah, so liver cancers have overt symptoms when it is too late, but however, there are always some subtle signs and symptoms like the loss of appetite, unintentional weight loss, subtle abdominal pain, which people often ignore. So, what I want to convey is that don't ignore any sort of even the smallest symptoms. Consult your physician, they will take it, they will evaluate it accordingly, and if at all there are findings suggestive of liver disease, then a liver specialist should be considered. So early symptoms are usually there. It's not that the patient presents with 8 centimeter tumor without any symptoms. They do have some sort of subtle symptoms which are often ignored. So don't ignore your symptoms, get yourself checked at the right point of time. And it's only that the patients who have advanced disease have overt symptoms when they came at a later stage of the disease.
Thank you for busting that myth, sir. Second is, in case of liver cancer, there's nothing a patient or a person can do to help themselves. It is all up to the doctors. Is it true or is it false that can a
No, no,
patient
it,
help
it's it's definitely false. So for managing any disease, it's always a teamwork. It's always a team of, I mean, it's a patient, uh, the family of the patients and the doctor. It's always a teamwork. So it's what we do is to sort of stage the disease, uh, to see what kind of treatment he needs, institute tumor-directed therapy. But it's the social support, it's the family support, it's the sort of patient's change in lifestyle to address the risk factors, to have a good healthy diet, to have a good lifestyle, to do regular exercise, to keep their physical and mental well-being is very much important. Uh, Probably more important in improving quality of life than the tumor directed therapy, but somehow obviously it's the tumor which decides the overall survival. So along with tumor directed therapy, all these aspects are very much important, and the patient and his caretakers have a very important role to play in the journey of treatment of liver cancers, because as we discussed, it's not the end of the road. Once patients are diagnosed with liver cancers, we can manage them fairly with a good quality of life, maybe beyond couple of years as well. There is recent data which shows that we can manage such patients maybe up to 4 years, 5 years as well. So a diagnosis of liver cancer is not an end of the road, and it's always the teamwork with the doctors, with the patient's caretakers, along with other industry support, which we need. It's very important to have a teamwork so that we have a good long-term outcome in patients with liver cancers.
Thank you for that response and for clarifying that it is a teamwork. And yes, it is definitely a teamwork. Not only a doctor's efforts can help you out, you also need to support and help yourself.
Yeah, and I would like to say that it's very important for platforms which are there, which fill in the gap between doctors and the patients, because there are lots of platforms nowadays which take it to the social media, which create awareness, which sort of convey the importance of early detection and early treatment. So that aspect is again very important, right? To have an meaningful impact in the patient's journey.
Very rightly mentioned, sir, and thank you so much for sharing your views and insights with us. Before we let you go, any closing message for our listeners out there or for the patients to watch out, not to patients, but yes, to our listeners to watch out and keep a track of their good health.
So obviously, you should have a healthy lifestyle. Alcohol is not good for the liver, for none of the organs, in fact. So it should be avoided, should be taken on social occasions. If you have any symptoms of liver diseases or any biochemistry or any imaging which showed some amount of liver disease or fatty liver disease, you should get yourself evaluated. It's very important to know, do we have liver disease or not? If yes, at what stage? Like, do we have a fibrotic liver or a cirrhotic liver? And then should consult a liver specialist accordingly. He or she will take you from there, what needs to be done, what evaluation needs to be done, and what treatment needs to be done.
Thank you so much, sir, for helping us
Thank you.
understand the truth behind these myths and awareness, and helping us and our audience to understand more about the silent threats of liver cancer. So it's a pleasure having you and having this conversation, sir. Thank you so much for joining.
Thank you, Simran, and thank you, Team VOH and Team ISAI.
Thank you, sir.
Thanks. Yeah.